Hey, future nurses, are you stressed about getting your license? Here at Remar Review, we believe in faith over fear. I'm Regina Callion, the #1 Nclex instructor in the world. Tune in to Remar Nurse Radio on Spotify and Apple Podcasts for new episodes every Thursday. We got that exclusive content. You don't want to miss it. We can, we will, we must pass Nclex. Yes, it's going to be patient number 2, as you guys would have imagined. All right, because we have the patient that needs the immediate assessment. Let's look at why the others are not correct. Well, a patient, number 1 says a newborn. Do I care if they're a newborn? Well, no, not really. I already know their assessment. They have an APGAR of 4. Okay, so I know when we're thinking of an APGAR, we're thinking like, oh, yes, but there's 5 categories to an APGAR. So I don't know, the baby could have a respiration, a full respiration. You know, I really don't know, but I do know that they have an APGAR of 4 right now. What about 3? 3 is the client with toxic shock syndrome. And somebody made a really good point about toxic shock syndrome. It is a bacterial infection. Absolutely. It's a bacterial infection that's severe. Okay. And it is going to cause your patient to have signs of an infection, right? They're going to have signs of infection, signs of shock. All right. So that means that they're going to have a fever. All right. Usually with toxic shock syndrome, right away, you don't start having organs shut down. Like literally you go into, right? So you have the fever, you don't feel well, your blood pressure could drop, your heart rate could go up. It takes a while though for this to happen. But we're going to just say, okay, if I'm talking about airway breathing or circulation, if I talk about airway breathing or circulation here, shock syndrome would be circulation to me. It would be circulation to me. So this is how I'm looking at these questions right now. All right. Yeah, I think 3 is a circulatory problem too, Rudo. All right. 4, the client with a gunshot wound to the right arm. Several people picked this, not the majority by any means, but several people did pick a gunshot wound to the right arm. Now, when you see the word gunshot, we immediately want to think that this would be, we immediately want to think that this would be like a critical case, the person who you would go see first. All right. And I'm going to go back to the APGAR score. So I'm going to definitely go back to it. So here we go. We're talking about the gunshot wound, but in the end, the gunshot wound is located where? All right. The gunshot wound is located, all right, is located in the right arm. So I'm not worried about the lungs or the heart. I'm not worried about the liver at this time. I'm not worried about any major organs with this gunshot wound. I have no reason to think that it is anything more than circulation at this point. All right. So I am down to another circulation problem. Now, if I go to number 2, I have a child who is scratching his back after a bee sting to the right arm. Okay, and I saw somebody's comment that said, well, people scratch at their bee stings when they get stung. But if you read this question more clearly, the where of where they're scratching, the location of where they're scratching is totally different from where the child was actually stung, right? So this to me is describing generalized itching, okay? This to me is describing a client who could possibly be having an allergic reaction, okay? And that, I don't think that would be reading into it, because what I'm seeing here is generalized itching after a potential allergen. So I'm not reading into this as a possible allergic reaction. It's very closely, it was very possible that this is. A child was stung by a bee. I know that people can be allergic to bee stings. I know people can be allergic to this. And then it says that the child is itching in the back, whereas the bee sting was in a different location. So if this patient is at risk for anaphylactic shock, I now have a baby with an APGAR of 4, or I have a child who may be having anaphylactic shock. And so I can get it down. I can get it down to these 2. And I don't know for sure if 4 is an emergency. I can't say that 4 is an emergency. Okay? I cannot assume that. But I do know that if a person has anaphylactic shock, I need to get them epinephrine. How soon? Right? Because I like that comment. Somebody said the scratching is just an initial reaction. Somebody said the scratching is just an initial reaction to it. So it's going to progress very quickly to complete airway obstruction. And I cannot take the chance of going to a baby with an APGAR of 4 over this patient. And so the safest thing for me to do is to administer epinephrine, which is going to work. How fast is epinephrine going to work? Epinephrine is going to work right away. Exactly. It's going to work right away. But if I go into the APGAR of 4 room, right? And the reason why there's an APGAR of 4 is because there is poor muscle tone or poor reflexes. Then I'm going to have to evaluate reflexes and muscle tone, right? Whereas my client who was itching now that I'm in the baby's room, they have total airway obstruction. All right. And so, yeah. So this is the issue. This is what I was left with. And this is why that's the correct answer. Okay. So is everybody with me on that? Okay. And yes, we've been studying since about noon, I would say. All right. We've been studying since about noon. So we are deep into it. If you're just joining us, we are deep into the content, and we've already went over prioritization. Let's do one more. Since you guys love the babies, let's talk about babies some more here. Let's do a prioritization with babies. Okay. All right. Let's go. All right. Here we go. The nurse is caring for 4 infants in the newborn nursery. All of the newborns are experiencing respiratory distress. Which infant has the highest priority? All right. Here we go. The newborn that is wheezing. Okay. The newborn who is grunting. The newborn who has mild retractions, or the newborn with tachypnea. Oh my goodness. We got 4 babies here. Which one is the priority? All right. And this is the baby one. This is the baby. This is baby respiratory distress. Oh, I got to move. I know I do not have time. All right. And listen, we've been studying hard. We've been studying hard to apply. This is pick one. Which baby is the highest priority? They're distress, 100%. Okay. All right. Well, I see the answers, and okay. Okay, so let me just give you the right answer. So the right answer is number 2. The baby who is grunting no longer has any compensation. Okay. This baby has used the accessory muscles to the fullest extent, and now they're literally just grunting. So this is why you got to know about grunting when it comes to newborns, because it is a sign of impending respiratory failure. All right. I want you guys to mark this one down. I think Facebook, you guys most of you guys got it right. If you didn't get it right, just write it down, because even with, congratulations. Yeah, even if you have wheezing or tachypnea, breathing fast, you still are able to get like some air exchange through, but the grunting just means that you're really about to give up. You're really about to give up. So that's one of the classic signs, okay? All right, do I have any more? I think I do. Okay, here's one. This is an oldie but goodie, meaning I put this one on here because I think it's so helpful, but if you have the DVD program or if you're in VT, you will see this one. All right, and it's simply this. Go ahead and give it a try if you know it. Who should the nurse see first? Is it, and if you already, okay, never mind. Let me just do it. Let me give it to you. A 7-month-old female with bulging fontanelles crying loudly, 3-year-old male with a temperature of 38.8 degrees Celsius, a 10-year-old female 48 hours after a tonsillectomy who is now confused, or a 9-year-old complaining of stomach pain. Well, we got a lot of babies here. We got infants. We don't have a lot of babies. We got a lot of peds. I'll just say peds and it'll cover everybody. But they all have an issue. So break these patients down, okay? And tell me who's the priority. All right. Remember what I said. Remember what I said about how we are looking at these patients, okay? And no, this is not on the paper. This is literally in my own world right here. I'm bringing you guys into my own world. Yes, grunting was the answer for the last one. Okay, so literally I'm bringing you guys into my world right now. We're off of the paper and we're just doing these questions for me, okay? All right, so the correct answer is going to be, yeah, most of you guys can see it. It's the 10-year-old female, 48 hours after a tonsillectomy, who is now confused. Why? Because this person has a change in an assessment. So after a tonsillectomy, we wouldn't expect for the patient to have any kind of confusion, right? We wouldn't expect for the patient to have any kind of confusion. Something is going on. Maybe there's a decreased oxygenation. I don't know. There's something happening, right? There's something happening. So let me just go back to the other ones just to explain it. Yes, C does not have an expected finding. So 7-month-old female, bulging fontanelles. The fontanelles are not supposed to be bulging. That indicates increased intracranial pressure. However, if the baby is crying, then those fontanelles will definitely bulge for sure. 3-year-old with a temperature 38.8. Okay, so this temperature is slightly elevated. However, when I look at the other choices, I cannot go to this one. Okay. And congratulations if you are getting these right and you feel more confident. I do always want you guys to feel better about studying with me, right? I never want you to leave feeling like you haven't learned anything. All right. 9-year-old, again, complaining of stomach pain. It's kind of like the 3-year-old with the temperature. All right. Why do you have these things? I don't know. I do need to find out, but just not first. Just not first. Okay. Something is wrong with my other patient. Okay. Here's some more questions. I obviously have more questions than I thought. And so I'm just going to keep on doing these questions with you. I have a few questions. I have a few more. So let's just keep studying. Okay. All right. So now we are going to this question, which I love. All right.
Real quick.
Oh, Mark.
Make a note so that tell them if they want to go order.
Oh,
some people
true.
Can order now.
That's true. We might not
don't
fish
have
it.
that rush at the end.
That's so true. Mark is saying, because he knows how this works. Like after the review, everybody that's thinking of ordering will go to the website and order, and it'll be all blocked up. So, and even I see the time is getting away from me. So even if I don't finish these questions, they are all in the VT, so you can get them from there, guys. So it's really, I'm going to try to press through and get to the end of this review. But if not, that is where you will find the answers. And I'm going to leave this video up for throughout the weekend as well. Okay. So this is the time now to order, as I see 5 o'clock is a pending on us. Okay. All right. Because I know everybody does that. All right. Okay. So this is a client here. Let's see here. This is a question, and it says, a client comes to the emergency department immediately after experiencing numbness of the face and an inability to speak and paralysis. The symptoms disappear, and the client states they no longer want to be seen. The nurse should include which of the following statements in her education? So check out this priority here. It's different in the sense that you have a client that had these symptoms, and the symptoms went away, and now we have to include something in our education. Is it A, the client has probably experienced a transient ischemic attack, which is a sign of progressive cerebral vascular disease? The client is not free to leave. B, the client is not free to leave when the symptoms reflect cerebral involvement. C, the client has experienced the effects of a thrombus and needs to be treated within 24 hours. Or D, the client does not have any cardiac issues as the symptoms have resolved on their own. Right? The correct answer is going to be, all right, you guys got it. I see you with it. It's going to be A. The client has probably experienced a transient ischemic attack, which is a sign of cerebral vascular disease. Okay. I need to, let's see here. Let's go to this priority question. I got to zoom. I got to speed line this thing. Let's go to this question here. I like this one as well. This actually, if you have the ultimate package, this one is in the question bank book. It says, a nurse is caring for Mr. Reed, who is prepared for surgery. When reviewing the client's chart, the nurse finds no consent form. What is the initial action to take? What is the initial action to take? See the situation. Is it going to be A, stop the surgery process? B, have the client sign a consent form? C, contact the physician? Or D, contact the nurse manager? Oh, this is such a good one. For prioritization. This is a really great one for prioritization. Okay. What do you guys say? A lot of people are picking 1, stop the surgery process. Some people are picking C. All right. Yes. You got to know your scope of practice in order to do this one. You got to be familiar with your scope of practice. Okay. Oh, okay. So great job. Okay, great job, everybody. I see it. I see the answers coming in. Yes. All right. So the correct answer is going to be to do C. Yeah, C is the right answer here. You definitely are going to want to contact the healthcare provider. Okay, contact the healthcare provider. So C is the right answer. I'm just going to go over the other ones quickly so we can just know why C is the right answer. If you picked A, stopping the surgery process, that is actually out of the nurse's scope of practice. So we're not going to do that. All right. That is actually outside of the nurse's scope of practice. To stop a surgery, yeah, you got it. To stop a surgery means that if a patient is NPO, then you allow them to eat because you're like, oh, well, there's no consent form, so let's stop the surgery. That means you don't give them any preoperative medications, or you don't prep them for surgery in any way. You know, sometimes you have to shave, or, you know, sometimes patients need to have a certain IV. So if you stop the surgery process, then that means that you're stopping those actions. The best thing for the nurse to do is to go to contact the physician and have the physician handle it. All right. Have the physician handle it. Okay. So now I want to go to let's do the pretest questions. All right. Just to be clear now, the workbook should be complete. Am I right? Is your guys' workbook complete now, and you just have the pretest questions to do? All right. And no, we're not following the chain of command. Okay. So I see this here. Somebody said, that's a good question. Do we need to call the nurse manager? Why are we not following the chain of command? All right. So here's the reason why. Because it is your job as the nurse to manage your patient. Okay. So in the hospital environment, perhaps in the hospital environment, in the real world, you take all your problems to the nurse manager or the charge nurse, right? And let them handle it. But for Nclex, you don't do that. For Nclex, you are the nurse. It's your patient. So it's very bad if you give off the responsibility to somebody else, right? So there's no reason why you can't, because look, it says here, the nurse discovers it, okay? A nurse caring for Mr. Reed, when reviewing the chart, the nurse finds no consent form. There's no information that the nurse manager can provide more than you, okay? There's no information that the nurse manager can provide. So you take care of it. You take care of it. All right. So call the physician and tell them what you found. All right. That's okay. That's appropriate. Okay. So, just to make note for you guys, Team Remar is here just another hour. So if you need any kind of assistance, if you need anything like that, this is Black Friday. This is the biggest sale that we have all year. Just know that in about 60 minutes, they're going to be gone for the weekend. So as I continue the review, if you need Team Remar, if you need any kind of assistance, now is the final closing hours to do so for Black Friday. All right. I hope you guys enjoyed this review. We're going to go over the pretest answers first, and then I'll do the tips for studying Nclex, okay? And then I'll be able to, hopefully, prayerfully, we'll be able to talk more about the virtual trainer and any other product questions that you guys have. So the pretest answers, the first question for you guys was this here. This is something that we recovered at the beginning of our review. A nurse is caring for a client with Meniere's disease. The client wants to go to a carnival. Which activity should the nurse educate the client to avoid? Select all that apply. The nurse wants to tell the client what to avoid. The client has Meniere's syndrome. Select all that apply. So we have A, bumper cars. B, throwing darts. C, Ferris wheel. D, eating cotton candy. D, eating cotton candy, and E is roller coasters. Which activity should the nurse, which activity should the nurse tell the patient to avoid? All right. And this is a select all that applies. So go ahead and be free to select all the ones that if your client had Meniere's syndrome, you would suggest that they would avoid. Okay. Okay, so the correct answer is going to be very similar, Ooh. All right. The correct answer is going to be, this is what I have. All right. This is going to start an argument, but I'm going to put it anyway. So the correct answer is C and E. C and E. I saw a couple people with C and E. C and E. All right. And so I'm saying C and E here because the indication is movement. Okay. And you guys know with the Ferris wheel, you are going to go around and around and around and around, right? Around and around. And with the roller coaster as well, you're going to go in an upside down spinning motion in that way. Okay. So those are the two. Even though the Ferris wheel is normally slow, but it is the rotational movement that clients with Meniere's syndrome should avoid, okay? The rotational movement of clients with Meniere's syndrome, where they're being turned upside down, where they're going around and around, that is going to precipitate more of a reaction than the bumper cars, than throwing darts and or eating cotton candy. Okay. All right. So let's go to the next pretest question. Is this? Oh. I'm sorry. Is this one? Do I have it here? Oh, okay. So I apologize. I don't know if it's not on here, but here's the answer to the question. Here, a nurse is caring for a client diagnosed with diabetes mellitus type 2. Which of the following is expected? So that would be the D. The urine is negative for ketones, and there is glucose in the blood. There's glucose in the blood. All right. So for that one, 3 here. Says after educational instructions have been given to a newly diagnosed client with type 1 here, the nurse would follow up after the patient makes which of the following statements? All right. And the statements are A, if my blood glucose is over 250, I will start checking my urine for ketones and decrease my insulin if the test comes back positive. All right. B, I will notify my doctor if my blood glucose level is above 200. C, I may experience polyuria if my blood glucose levels become too high. Or D, shakiness is a sign of hypoglycemia and indicates that I need to eat more. All right. Here we go. All right. So the correct answer here, okay, the correct answer here is going to be blood glucose is over 250. I will start checking my urine for ketones and decrease my insulin if the test comes back positive. All right. Okay. Next pretest question was, all right. 4, a nurse is caring for a client with a newly implanted cardiac pacemaker. Which is the most important action by the nurse? Okay. A, educate the client on how to avoid post-surgical infections. B, demonstrate to the client how to perform deep breathing exercises. C, monitor the heart rhythm. D, evaluate the post-surgical pain to decrease activity and allow the client to perform daily activities. All right, here, what is going to be the most important action for that nurse to do? All right. This is it. Come on, guys. You got to finish strong. We have been studying. I'm so proud of you guys. I don't know if you've ever studied this long, but you did it with Remar. And I'm so happy that we studied together today. This is Black Friday. This is how we get down. No days off. We're serious. You can, you will, you must. The correct answer was monitor the heart rhythm. That is the most important thing. This patient has a newly implanted cardiac pacemaker. Okay? So everything is going to come secondary to monitoring if that rhythm is affected. Did you get that right? Hearts on the screen if you were able to identify that as the correct answer. Absolutely. All right. Absolutely, that's correct. All right. Do number 5. Let's do number 5. And we are doing well. Team Remar is here to help you guys. And we're so excited for everybody who is making the commitment right now today. Question number 5 is simply this. Okay. A nurse is working on a cardiac unit. Which patient should she medicate first? Perfect. Okay. The client who needs digoxin, who has an apical pulse of 56. B, the client who needs furosemide with a serum potassium level of 3.3. The client who needs amiodarone with an EKG reading of ventricular fibrillation. Or D, the client who needs verapamil with a blood pressure of 120/80. I see that. I see people doing the right thing. All right. The correct answer, guys, is definitely C. Okay. It's definitely C. Okay. So let's do so that was the pretest. How did you guys do? Do you feel more confident about yourself in the areas of EKG? Do you feel more confident in the areas of, what are we talking about? Diabetes mellitus, prioritization. I really wanted to go over all of the tough topics as well. All of the tough topics as well. So let's do the tips for passing Nclex. Again, the sunset is drawing near, and I know I have so many questions here. So everything that I don't cover today, which I think I'm trying to cover everything. Everything I don't cover today, again, I will make sure that you guys get it. Let's do the tips to master Nclex. And these are just really my thoughts on how you can succeed on this test. Number 1 says content before questions. I hope that today proved to you guys that if you study the content, you absolutely can do the questions and do very good at them right now. Okay. Right now you prove that today. Also, tip number 2 is confidence is key. Listen, guys, if you don't believe that you can pass Nclex, how can I believe it for you? All I can do is go off what you are giving me back, the vibes that you are giving me back, right? So confidence is key. A lot of nursing students I meet, when they come on ice, I don't think I'm meant to be a nurse. You have to break out of that. Understand that this test is difficult, all right? This test is difficult, but we have so many testimonials in the Remar family of people who literally had hopeless cases, all right? And they were able to pass Nclex. So don't you dare look at yourself and think that you can't do it too. You can pass this test. You're more than smart enough to do it. You can pass this test. You will pass this test. You got so much riding on this test that you must pass it, all right? But you have to have the confidence in order to believe that you can do it, all right? Third thing, forget about the real world, and forget about in your mind how you think it should be, what somebody told you, how your other people did it. Like literally, you have to go by the book, all right? You have to go by the book. Forget about the real world, okay? And this is something that most nursing students have, this anxiety. Yes, you have anxiety. There's nothing wrong with you for having anxiety. But what you need to know is the anxiety has to have a purpose, okay? And the anxiety is to help you feel Nclex test is coming. No, that's a good thing, right? No, that's a good thing, because that means that you don't want to stay in this position forever. All right. You don't want to be perpetually studying for Nclex. And I know, even with me being a super crazy, fun instructor, you don't want to study with me forever. You want to study with me for 6 to 8 weeks and then move on. That's the goal, right? So with this, I want you guys to think of this process as something that is temporary. And the anxiety is to help you move. The anxiety is to help you get out of the situation. That's what I want for you guys. Okay, so using the anxiety for the good. And then, this is so important, having a realistic study calendar. Having a realistic study calendar. You guys have a real life, okay? You have a real life. And you have to understand that passing Nclex is going to require you to fit the studying into your real life. All right. And I have a real life as well. So I understand the challenges of trying to. That's why when I talked about the study calendar that was in the virtual trainer, I made it so that it's realistic. I made it so that you can look at it and you can say, oh man, you know, you got me studying from 8 to 10. I saw somebody say, but I work from 7 to 3. Okay, these numbers are flexible. So if you work from 7 to 3, you can change this day till 5 o'clock, and you can study from 5 to 7, or you can study from 9 to 11. Like, I just wanted you to see what a minute breakdown and how long it should take you to study each topic. So you have to be real. Like, if you're studying in the library from 7 in the morning to 7 at night, that's not real. That's not real. And that's not going to be something that you're going to be able to maintain. So it has to make sense for you. Okay. All right. And then this is so timely for Black Friday. And this isn't, you guys know that this isn't even like a new tips to master Nclex. This is literally my tips that I always say. Prioritize the investment. Guess what? It costs money to become a nurse. Becoming a nurse is not a cheap endeavor by any means. It costs money to get through nursing school. It costs money to buy those scrubs. It costs money to prepare for the board exams. So you have to understand that if you are required to pay something, it is part of the process. All right. Nothing is owed to you in this world. Nothing. I'm telling you guys. And so what I need you to understand is that the investment that you make, the return is so much greater. And I do these free reviews just so you can understand the value of education, because I know what it is. I literally have bought books within the last 2 weeks that cost hundreds of dollars. I mean, one book, $100. But I knew that it would take me to the next level. And that's where I'm trying to get, the next level. And so for you guys, I want you to understand that when you decide, first of all, that you're worth the investment, but that two is that when you make the investment in yourself, the return is greater, then I think it will free up the time that is wasted doing what needs to be done. And I cannot say enough how, we do free reviews. We are the kings of free Nclex reviews, because we really want to help you to see that education is the new money. Like, if you want to have wealth in your life, you have to have a certain level of knowledge, period. All right. And so as nurses, you guys already have the training. You already have a wealth. You guys are already millionaires just based off of what you know, right? People pay money for medical treatment. People pay money for medical care. You guys are literally the hands that provide that care. You are invaluable. And I don't know if you guys realize how much money hospitals are paying trying to get nurses to come work for them. Yeah, that's all for you. Like, that's all for you. I get jobs offers right now, text messages to my phone like, can you come and work? The pay is $90 an hour. Can you come and work? It's $110 an hour. Like, those are the kind of job opportunities that I have. All right. So I need you guys to see yourself as having that same kind of potential, having that same kind of ability. But it takes an investment to get there. You're not just going to get there by doing what you always have done. That's not how it works. So prioritize the investment, people. All right. That's just my hobby horse on that. And, you know, so like, those are my tips to pass Nclex. Those are my tips to pass Nclex. This was a way for us, Team Remar, to give back to you guys. We know that, you know, it's the holiday season and you want to slack off. I know the Christmas movies are coming on Hallmark. I know that your kids are home and you want to spend time with them. But trust me, once you get your nursing license, you will have more time to do all of the things that you love, but you cannot quit right now. Now is not the time for you to stop. All right. You don't have time. You don't have time to enjoy the holidays. There's nothing that you could be enjoying right now more than studying for your Nclex exam, because that should be the most important goal in your mind right now. All right. You buy your kids a toy and they play with it for maybe 4 hours. All right. If they're my kids, I got a 5-year-old and a 3-year-old. They're not even playing with it for that long. But if you invest in yourself, if you invest and get your nursing license, you can literally raise your kids up a whole nother, economic status, a whole nother lifestyle. I really want you guys to make this Black Friday matter. Like, make this Black Friday one that actually will change your life in the future and not just temporarily until the next thing comes around. And so, by you spending the day with me, this allows me to see seriously that you guys really are serious and you really are committed. So that is that. Okay. Yes. The best Christmas gift to yourself. So I want to thank you guys so much for being with this review. I want to talk about the Black Friday sale, really, because I know the Team Remar is leaving pretty soon. And so if you guys have any questions that I can directly answer, I want to do that, because at the end of the day, the knowledge that you leave here with will help you so much more. All right. And it will make your life easier. I'm not trying to make your life harder. I promise. I really want your life to be easier than when you started this journey. Studying for Nclex can be a lonely, somebody can testify to this. Studying for Nclex can be a lonely process. So when you found a family, hey, the Remar Nurse community, this is the way that you can stay connected and feel connected and actually get good information. Like, some people are saying, oh, the information today was so good. All right. And I appreciate, Audra, I appreciate your thanks. I appreciate Infinity, your thanks. You're very welcome. You guys are all welcome. This is my passion. This is why I do what I do. I started Remar Nurse 10 years ago. I started Remar Review 10 years ago to help nursing students feel more confident when they took their Nclex exam. You guys know that I appreciate a simple, straightforward way to teach, because that's how I was taught. I started my nursing career at the age of 16. I took care of my grandparents at home. My family could not afford to put my grandparents in a nursing home. We just did not have the money to do that. So both of my grandparents got sick at the same time. My grandfather had a stroke, so he couldn't walk, he couldn't talk, he couldn't swallow. My grandmother, she had diabetes, a brittle diabetic, so she lost her vision. She was blind, and she had to get both of her legs amputated as well. So they both got sick at the same time, and we had them at home. And a home health nurse came in. She said, who's going to be responsible for taking care of these two? And everybody looked around. And I raised my hand and I said, I would be responsible. And she literally took me, a 16-year-old, I was a cheerleader in high school. I had no clinical education. I had no nursing theory. She took me and she taught me very simply how to give nursing care and how to take care of the people that I loved. And that experience is what has led me to teach in the way I do, to have the passion in the way that I do, to help nursing students feel competent, feel comfortable knowing about nursing, because you guys can absolutely do it. If I can do it, literally, and I know we say this as a family, but literally, if I can do it, 16 years old, no idea, what nursing was really, but she taught me. And so now I'm here to get to the next generation. And that's why I created Remar Review and everything else, VT, everything else. So, just quick questions. Am I able to show the VT, you think, or?
Oh yeah, let's try.
Okay, so I'm going to go and show you guys the virtual trainer. If you have not seen it before, I'm so excited to show you guys this, but I see a lot of questions about it. So again, just quickly, with the virtual trainer, you get 2 books. You get the brand new virtual trainer workbook, and you also get the very famous, always popular #1 on Amazon. Come on in here. Am I in your way? Very famous, always popular #1 on Nclex, Amazon for Nclex. The quick facts. This is the 5-star quick facts. Okay. So, okay. So that's one of the questions. So people said, hey, if I have the DVD program, should I still get the virtual trainer? I would say yes, because the virtual trainer has this wonderful feature of accountability. And one of the things that drew me to create this specific program is that I saw the level of accountability that could be acquired from the virtual program. And again, with the DVD program, you have the information for however long that you need it. But there was a lot of nurses that literally got the DVD program and it just sat and they didn't study for months. And I thought, well, certainly nurses don't intend to just sit for months not having their license. And so I knew that some people have a desire to purchase and they're motivated to purchase the Remar products. But then after that motivation goes away, they just lose that desire to study. And with the virtual trainer, because it is there, it is meeting you at every step, and it is showing you how often you're studying, where you're studying. It's allowing you to take online exams and things like that. There was this accountability that I saw, and I saw people getting their license a lot faster in the virtual trainer. Plus, I was able to, I'm able to update, and they see your head, but it's Mark.
Real clean.
It is clean, but I was seeing that people would get their license a lot quicker. All right. I purchased the virtual trainer without quick facts. Yes. Perfect. So is there a portal? Is there a virtual trainer book to print? So no, there's not. And hopefully I can get in here. In the virtual trainer, you're going to get these physical books, right? This is the new activity book, the new practice exam homework book is in here. So you're getting these books mailed to you. Now, in the virtual trainer, there is a section called File Vault, and the File Vault will allow you to print everything that I uploaded into that virtual trainer for you guys. So if you were in it last night, you saw that I uploaded a Select All That Apply quiz. I uploaded some drug cards. And so you can print out that there. All right. You can print out that there. Is there a money back guarantee with the VT? Nope. There's not a money back guarantee, but I can say that our current online academy had a 99% passing rate. So the virtual trainer is the best of the DVD program and the online academy. So I'm expecting the same results in this virtual trainer, because the online academy has, the basic online academy did not have nearly the features that the VT has for you guys, and the passing rate was still phenomenal. Okay, no, I can't. I cannot transfer the VT information into the DVD program because it's literally built into the system. The way the technology is, I literally was inputting videos and things like that so that they're responsive. The virtual trainer is user adaptive, and there's no way I could email that just the technology of that program. Yes, the virtual trainer. So when does the 6 weeks start? That's a great question. The virtual trainer gives you access immediately. So once you purchase it, you get in there right away and you can begin studying. All right.
It's 8 weeks though.
Oh, it's 8 weeks.
Yeah, they get 8 weeks.
You get 8 weeks in the virtual trainer. Yes, if you're an international nurse, we can ship these books to you, but you will have to pay customs. All right. So we'll ship them to you guys. We'll ship them, but you have to pay customs. You have to make the decision about if it is worth the investment to you. I'm telling you guys that I believe that this program, well, I know from results, like I said, I've been doing this for 10 years, and this is the most advanced Nclex review. Is the most user-friendly, but I think it's the most effective that I've ever seen. Tip 1, content before question. Okay, I have the ultimate package just under the virtual trainer. I'm saying yes, because this is the why. Because with the accountability of the virtual trainer, and let me just show you guys. So, it didn't connect. Let's put it on there again. With the virtual trainer, you are able to go inside, train, take notes on the screen, print things out, start discussions. I'm putting all of my newest information in there. Anything that I create is going in the virtual trainer. So literally, even if you just get it for the Black Friday price, the value is there so much so that it just makes sense. Like literally, like I was saying, with this virtual trainer, and let me just do the calculations really quickly. It's $199 for 8 weeks, right? So that's literally $24 a week. Okay. Here is the virtual trainer right there. So you can see that this interface is there to provide you with so much. All right. You have the training center. That's where all of your lectures are. Next to the training center, you have your report card. Let's just go into the training center. And here you have 3 sections that are dialed up for you, ready to go. Anybody that started, you guys know you have before the books arrive. So even if you purchase it tonight, no, you won't have your workbooks, but you can get started right away. Right? I have activities in there for you. We have videos to explain how to use a virtual trainer. So there's no questions. When do the books get? So right now, if you purchase tonight, your books will go out on Monday. And what did you click on and see? All right. So just the getting started, you can start taking quizzes right away. Go ahead and click on it so they can see some of the activities that you will be doing. And the passing rate for the virtual trainer, 95% on anything that you do in here. So when I say you talk about accountability, I have some drag and drop here, right? So getting you started, let's just go over some anatomy. Let's go over some physiology. Let's move some things around. Like this interface was so different. I just really knew that once this was built, that it would be amazing help to nursing students who recently, failed Nclex, those who struggled, those who didn't feel motivated to study. Let's go back and there's some other features that I want to show here. And like I said, we have now over 300 people that just joined the VT last night. So I'm expecting this to be like worldwide takeover, right? When it comes to getting nursing students studied for this exam. And I wouldn't have done this if I didn't think that there would be a real benefit. Because as you guys know, we were doing okay with the DVDs. Like the DVDs were extremely popular. They were extremely successful and helpful to nursing students. But I needed for you guys to be able to take more control of your learning experience. I needed for you guys to have that additional accountability. And the way you do that is through technology. And so as I'm moving forward, then I need you guys to move forward too. And there's nothing more important than just getting that education. So yes, so here we go. I try to pay, cannot, please help. All right, so that's not ready yet. Okay, so how much content would you say has been added to the ultimate, to the VT? Okay, perfect. So the content that I added to the virtual trainer that those who have the DVD program wouldn't have would simply be what's in this book here, and also what I put into the getting started sections of the VT. So all of the videos have been redone in the virtual trainer, and I'm gonna try to get you guys a preview of video so you can just see the difference. But all of the videos have been done. There I go. Okay, all of the videos have been redone. The clinical judgments in here are different. So there's 18 clinical judgments, and I have literally just expanded the topics that are in the DVD program. So it's not like anything was taken out. I've just expanded on what I've talked about. So I have made every study session more like an advanced study session, I would say. And the reason why I did that is to prepare nurses for the future changes of the Nclex exam. I know the Nclex exam is changing. All right. I know the Nclex exam is changing, and I know they're going to put a priority on different things. And so I'm trying to get you guys in a mental mindset to understand that if you're testing in 2020 or ahead of time, that you know that your accountability, your studying needs to look a little bit different. All right. Are the actual videos of fetal heart monitors? All right. Yeah. So with the virtual trainer, again, this is going to be your interface. I like that question. Let's see. I purchased the VT. Okay, I like that question. Yes, there's actual, what we did was what are you saying?
Go back to it, please.
Okay. So what we have done is we have definitely added the information there. If I try to pay, can I help? Please help. If you need help, go to remarnurse.com and you can chat us. Okay, you can chat us. If we buy it now, can we start using it later, like in February? No, we cannot. We can't do that. So once you buy it, you launch it. All right, once you buy it, you launch it, and it's there for you guys to launch. So this was one of the questions. If we enlarge the screen a little bit more, you guys can see. This is one of the questions that we were talking about, and this is the before getting started activities. So before the books arrive, I have you guys doing some, and I can see now if I even look at the views of it, 75 people have viewed this. A lot of people are in their VT and they're literally just playing or think there's any discussions yet. I was in there today. But I see that nursing students are getting comfortable with this format. Again, this is different from any other online Nclex review that you have seen. Okay. And I wanted to release it at a time where we can, this is what you are getting with the virtual trainer. Before the books arrive is literally a section that allows you to get started before your VT workbook and your quick facts book arrives. So this is the first look. All right. Do I have test taking strategies in VT? No, I don't. I just have content in VT. I just have content. So let's check out, can we check out my report card and kind of see if there's anything? So my report card is a great way for you to see what you've been doing, what you have been doing. So literally we were just in a brand new course. So before the books arrive, you can see that nothing was done there. And it'll tell you your progress for every course. Let's go back to my file vault here. And these are just the different features of the virtual trainer. So if you go to my file vault, I'll show you like what I uploaded yesterday for you guys in the VT. There's 17 files, and these are all downloadable, printable files that you can use and study for yourself. print them off if you want. What the major files were that I had to get in there for you all were the calendars, right? So I put in the calendars week by week for RN and PN. I got a lot of PN students, and this is for them as well. So you'll have access to the calendars. There's lecture notes, there's drug cards, there's practice exams. So all of these things are going to be included in the virtual trainer. And this was the reason why I wanted to move to this format, so that I could always share with you guys new information. People were asking me about the possible date for the Nclex change. I don't know that information. I really don't. I don't know. So I'm just telling you guys. Yeah, you want to do a video? Okay, cool. So let's look at it. We're going to go back and see if we can do the video. It says, can you, somebody's saying, can you please buy this for me? They're tagging a family member. Can you in installments? No, there's no installment payment that I know of for it. I don't think so. That what we did was, a lot of people did not like how our last one we had PayPal. So now you are able to pay freely. You don't have to use PayPal for any kind of payments or anything like that. You can use your debit card or credit card. If this is the holiday season and you think you need this to pass Nclex, I would tell your family members, tell your husband, I need to pass my Nclex by any means necessary. This is the time where people are able to, make those special gifts and donations for you. So when you talk about the DVD program and the virtual trainer, I just want to show, I guess we'll have to do the pregnancy overview. With the virtual trainer, you will go in order through all the chapters. So we're going to just play a video here, and you guys can see the new formatting that we have done. We wanted to make this perfect for you guys. So we put in the educational text so that you can see
hey guys, we are going to get started with your maternal and child overview by talking about the pregnancy lecture. Let's get started by knowing that the hormone responsible for pregnancy is the HCG hormone. I have that written down for you. So now you only have to take notes of the things that I'm continuing to say. We are going to look at the probable versus positive signs of pregnancy. You have to know this for Nclex. So there are 3 probable signs that I want you to be familiar with. The first one is Hagar's sign. Do you know what Hagar's sign is? It is a softening of the uterus. Number 2 is Goodell's sign. Sometimes people get Goodell's sign confused with Hagar's, but Goodell's is actually a softening of the cervix. And the third sign is called Chadwick's sign. This is where you will see a bluish discoloration of the vagina and cervix. The fourth probable sign of pregnancy is actually 2 things. The first is all blood tests and all urine.
So if you have the DVD program,
that's right,
you can see that it's the same information as well, but we added components to help you really solidify the information even more. And there's no video, there's no nursing educational videos that are really entertaining and really easy to watch like the virtual trainer. So I wanted it to be totally different. Just like you guys, enjoy studying here, I wanted you to have that same kind of experience with the virtual trainer. So these are the new not the new DVDs. These are the new videos that are the benefits of both the DVD and the online academy. And you can see I developed this. So this one video is 42 minutes, which you guys know for myself, I normally never talk that long. I normally never. So when I say I really expanded it, I really filled it out more. I've taken more time for explaining. This is what my attempt was for you guys in this virtual trainer. Okay. So this is what we're talking about. This launched today, the virtual trainer. I'm so excited for you guys that are in it to, give me your feedback. yes, if you purchase the VT and it expires, when you purchase it, you'll see the renewal fee of $105, and that renewal fee you don't pay. You don't pay that today. That is what the renewal fee will be if you don't opt out for it. So literally for another 30 days, it's $105. That's $3.50 a day. So we literally tried to take the lowest price for you guys to continue on your studying. And even if you do get it today and you renew it one time, that's still going to be cheaper than the full price if you wait. So the full price for the virtual trainer will be $369 for the virtual trainer. But right now for Black Friday, it is $199. Incredibly low, incredibly insane. But this is what we do for Black Friday. We have a great, amazing sale, and we do it for nursing students. So this is a first look at the videos into the virtual trainer. Again, all new, all recorded, expanded lectures. And can we still get the VT if we're going at the end of December? Yes, you can. Yes, you can still get the virtual trainer. And it's for 8 weeks, 60 days, 8 weeks. I don't know why I've been saying 6 weeks. But literally, we're talking pregnancy here. How helpful would it be if you're an audio or visual learner to have these lectures? Make it easy for yourself. Like, this is the future. I'm claiming it. This is the future of Nclex reviews right here. This is the VT, the virtual trainer, first look at how we have done it. So you guys that have it, go ahead and tell me how much you like it. All right. And everybody that purchased the ultimate package, we gave you guys such a discount because it was a clearance sale. And that was on the website, that it was a clearance sale. So if you guys are interested in the VT, you still can get it. So the question is, do I use the VT first or do I use the virtual trainer? Do I use the DVDs or do I use the virtual trainer? You definitely would use the virtual trainer first, okay? You definitely would use the virtual trainer. So the DVDs you have, all right, with you forever. And that's one of the benefits of the DVDs is that you have them forever. But now everybody that studies with Remar will be put in the VT because there's just so much more information for me and you to connect with. And there's so much education that what I'm saying, you actually will be able to take hold of even more. Okay. So I see the question. I already have the other books and DVDs. Can I just purchase the VT? Yes, you can just purchase the VT. You can just purchase the VT. And what you would do, and let me get in here. What you would do is you would choose the option that says, I already have quick facts. If you already have the DVD package, don't pay for another quick facts. Just pick the package that says, I already have the quick facts book. And then so you'll just get now the virtual trainer. It will be immediate access open to you. And that's why the team Remar isn't taking calls on the phone about it, because you create your own account. You create your own password that allows you to reset yourself. Somebody says, can I reset myself in the virtual trainer? Yes, you absolutely can. So you create all of that for yourself with the VT. All right. And so this is the first look inside the videos of the virtual trainer, all redone, expanded. I love it. Love it. Love it. Love it. Can you take it anywhere? Yes, you can take it anywhere with you. You can take it on your phone, on your iPad, on your laptop, anything like that. There is no free preview for how it works. I'm sorry. No, there is no free preview for how it works, but this is it right here. All right. So this is what the videos look like. This is how they're designed. Again, you get a workbook that you are filling out. If you're familiar with the style of Remar review, then you will know that everything is done so for your understanding. All right. Nothing is done to waste any of your time. The goal is that you get your Nclex exam in 6 weeks. All right, get your Nclex exam, and you got to use the code Black Friday, okay? You got to use the code Black Friday. I will be putting all of my Monday motivations, my Let's Talk Nclex, all of that stuff will be in there in the virtual trainer now. And the question is, will you still go live on Facebook? Yes, of course, I'll still go live on Facebook. But for those of you who have not been able to keep up with those, you can find them all in the VT. So that's a great question. She asked, if you have the DVD program and the VT, which calendar should you use? Oh, I would say definitely go with the virtual trainer calendar because it is more, the virtual trainer calendar is more specific to the minute by minute breakdown, which I think is helpful. Some people don't like it. Some people don't like to have like a minute by minute breakdown, but I definitely think it's helpful. Okay. And this is the time now. Team Remar will be leaving in about 12 minutes probably. So if you have questions, or this is the time to get it. This is the time to go to Remar Nurse, call. Can I have the question? I already have quick facts. No, the virtual trainer program is on its own, so you're not pairing it with anything else.
Or you can just order it separately. You know, everything is on sale right now at on remarners.com. So if you get the VT and you want the question bank book, you can just order that separately as well.
Yeah, that's true. So again, the question bank books, the DVDs, they're super low right now. And this is the virtual trainer. It will not be $199 until Monday. Okay. This Black Friday sale will go through the weekend, which is cool. And on Monday, we'll be doing Cyber Week. Okay. All right. So
on Monday, we want you to join us, join Regina at noon for Monday Motivation and Let's Talk Nclex.
It will be just like it is now. The only difference is we will be putting all of that stuff into the virtual trainer as well. Does it expire after the 8 weeks? Yep. After the 8 weeks, you are able to renew your VT access, but it is available to you right now for $199.
And ideally, it's only going to take you 6 weeks to go through the program, especially if you're sticking with the calendar, and you have an additional 2 weeks just for life issues. Some of you may be joining us for the first time, first time studying with Regina, looking at the content. This is something that we do here at Remar Review every single week for Monday Motivation. Let's Talk Nclex at 12 o'clock noon. So if you're watching on Facebook, make sure that you like the page. And if you're on YouTube, make sure you subscribe and hit the bell for all notifications so that you don't miss anything.
Perfect. Yep. So is there any more questions? I see one. Does it expire? I addressed that one. Let's see. So can I use the VT as a remedial course for the board? Well, you're going to have to check to see what the requirements of your state board of nursing are. There's 50 states, and so I don't know all of the requirements of them. All right. So give them a call or give them an email. And we're going to try.
Minnesota.
Yeah. If you're in Minnesota, they definitely will accept Remar. So if you're applying to that board of nursing. Okay. And let's see. Okay.
Somebody says, can we get prayer before we end? That's cool.
What is the discount for Cyber Monday?
Cyber Monday, if you wait till Cyber Monday to order, or actually it's Cyber Week, okay? So starting Monday through Friday of this upcoming week, you're going to save $120 off of your virtual trainer subscription for that 60 days of access, right? So order today, it's $170 off. Crazy Black Friday deal. But understand you might just be finding out about it. You have to get things situated. It's going to be $120 off for Cyber Week. After that, it's $369, which is still an amazing price for the value that you're getting and your nursing license.
Perfect. Yep. And another thing is, can I use the VT for my Husky exit exam? Yes, you absolutely can.
You're going to be over prepared, like in a good way.
Yeah, I think so with the virtual trainer. So I think you'll really enjoy it. The virtual trainer is set up for about 2.5 hours to 3 hours a day of studying. And again, the daily calendar will show you some subjects will take a little bit longer for you to study. So I have written that down for you guys. And again, it is just, I have you only studying 4 days a week, only 4 days a week. So
that's nice.
Yeah. So it's really realistic. I know some people were like, I don't know if I can get through it, but trust me, I think you can.
Yeah, if you're preparing for exit exams, this is perfect because you get that out of the way. And then also you're transitioning right into your Nclex prep. And so you're really going to be ahead of the curve in terms of your studying.
Yeah. And if you purchase VT, somebody says, I want to purchase VT, but I don't want to study right away. I think right now the price is so great for it that you could actually purchase it. And even if you renewed it one time or two times, it would still be cheaper than the full price, which it will be after Cyber Week. So this would be the time to purchase it for those of you who maybe want to start studying in maybe like 15 days or 30 days. So
everybody that ordered last night and today, your access continues. The renewal period doesn't kick in until, I believe, January 30th or the 31st. So, I mean, that's a long time from now.
That is.
And honestly, we really want to see your testimonial before, like, by that date. You know, so if you're testing mid-February, you're good to go. If you're even testing in March, you're still good to go ahead and get started, because as Regina said, the cost of starting now and then also doing a renewal or even 2 renewals are going to be better with the virtual trainer than doing it at any other time. Plus, you got to get in there and get this content. It's just going to make your studying so much easier. Like, you can continue to struggle until then, but sometimes it's just worth the relief. Yeah,
and I think, you know, we have some testimonials about people that just got into the virtual trainer, and they literally were just like, I am loving this. It's so easy for me to study from. And I hope that you guys, after our Nclex review, feel more confident about that process. Like, you feel more confident about being able to learn the information. And so this was a preview of what will happen once you get into the virtual trainer.
And that's what it's really about. It's like, we're talking a lot about the virtual trainer, but the VT, the virtual trainer, is just like it's a mechanism for to ease the study, to get the content that they need, and to help you get your nursing license, because that's what it's all about in the end. So the VT, it's amazing, it's fantastic, it's like advanced technology, the best around. But the important thing is that you feel confident about the process, so that you can actually take the steps, do what you need to do. Because really, you know, it's not like you don't put the effort in. You know, it's not like you just, you know, you're lazy. That's not the case. It's just a matter of getting it to you in the right format, so that you can feel at ease with the process, overcome this fear and anxiety, and push through to get your nursing license that, you know, you've worked too hard to leave without your license. Right. And so it's just right around the corner. So we just simply want to encourage you that you are enough, you have exactly what it takes to be successful. If you've passed nursing school, if you've got into nursing school, you can complete nursing school. If you finish nursing school, you can get your license. Even if you failed 4, 5, 6, 7, 8, 9, 10 times before, it doesn't matter with Remar. It doesn't matter with God, because with God, it is possible. So we just want to encourage you that you're going to get this, you're going to get your license.
Yeah, absolutely. Perfect. Yeah, absolutely. So before we close and transition, we're going to have Mark pray and do all of the things that, you know, we normally do at a live. We just want to support you guys. Black Friday is a time where you have a lot going on. We know the holidays are coming, but we don't want you to lose track of your goal of wanting to pass Nclex. And so that's why we released the virtual trainer, just to kind of motivate you guys to continue to make this a priority. All right, make this a priority. So it doesn't matter where you take your exam in. No, it doesn't matter. Let's see, we don't have a postal code in Jamaica, so
we ship stuff to Jamaica all the time.
Yeah. So they're saying.
So if you don't have a postcode, I would just put all zeros in there.
Okay. Oh, that's cool.
Yeah. That should help. And if you can't resolve it, give us a call on Monday. We'll help you out.
For sure. For sure. Because we want to make sure our students in Jamaica definitely get this information. I love Jamaica. I love going there.
Yep. So we're going to transition from talking about the VT from all things Nclex. Last call, hit up remarnurse.com. That's REMAR nurse.com.
Absolutely.
For all of your Nclex needs and to take advantage of these Black Friday sales. Also, Cyber Week is coming. Join Regina on Monday at 12 o'clock. Eastern time for more information and for another part of the Nclex review.
Yes,
this is what we do.
We went like for hours.
And there was still so much more. I know. And a lot of it is actually inside. Actually, everything that wasn't covered here is inside of the VT. So we hope that you can get that resource and be successful with that.
Absolutely.
All right.
Yep.
So, Regina.
Yes, sir.
You know what? I got to tell you something.
Oh my goodness.
I got to tell you something.
What?
All right. How long have we been together?
Well, it'll be going on 8 years.
8 years.
January. We will have been married 8 years in January.
That's awesome.
Yeah.
You know, so 8 years in January. Mm-hmm. You know, before I met you, I was dating this really amazing young lady.
What?
Like, really cool person.
She was okay.
She was like, I like quality and, nice individuals and all that, spiritually rounded and all that, but it didn't work out. Mm-hmm. And before that, I was actually accepted into law school. Uh-huh. And I went and was doing pretty good. But I still remember my dad's face when I told him like that it didn't work out. Law school? Law school. Mm-hmm. I was like, Dad, you thought I was going to be a Thurgood Marshall. Right. That's right. You were supposed to be a lawyer. But it didn't work out. Okay. And do you remember that nursing school that we were trying to reach and get a hold of a couple of years ago? We talked to the president, mm-hmm. sent letters, mm-hmm. and said, "Hey, we've been watching the scores, and it's right around like a 70, 75. We can help." Yeah. And that's so true. We got some promising contacts. Said, "Hey, this might be good, but mm-hmm. like it didn't work out." Right. No, it didn't. And then just last night, when we were getting ready to, like, what? Just last night, yeah. When you were getting ready to launch the VT, uh-huh. There was like one student who somehow like got into the program. Yeah, that's so true. There was one student that broke into the virtual trainer. Into the VT early. Well, she didn't break in because she did literally buy it. But yeah, she bought it. She bought it like 2 days before it was released. So we didn't release it until when? Yesterday. Yeah. So she got into it. Wednesday. Yeah. She got into it Wednesday night. Like at 7 p.m. Yeah. Shout out to that student. She said, "I'm super eager to get this VT." Like she literally was. I'm like, wow. And like, so we had this nice launch, and then she gets in. She's like, "Wait a minute. Like, it's not ready." Right. Exactly. Right. Yeah. And so it was like, wow, that didn't work out either. Well, yeah. Yeah. And so like what I'm realizing is, yeah, where are you going? Where are you going with this? I mean, this stuff that just wasn't working out. There's a verse that I'd like to share with you all. Okay. It's in Romans chapter 8, verse 28. And it says, "And we know that all things work together for good to them that love God." Oh, I like that. "And to them who are called according to his purpose." And so when I was in that relationship, I was like, man, this is crazy. Like, where am I ever going to find somebody this wonderful again? And then I met Regina. Yes. And then when I was in law school, mm-hmm. and I had to tell my dad, like, "Listen, Dad, I failed out of law school." And I'm like, okay, what am I going to do as a, career-wise or career choice with my life? Why'd you fail out of law school? This was before me. I would never let him fail out of law school. You know what? I realized two reasons. One, I wasn't disciplined enough at the time. That's number one. And number two, I started to feel that it wasn't the place where I was supposed to be. And because I felt like that, I didn't give it, the effort that was required in order to meet the standards of law school. And so I looked around like I don't belong here. Yeah. And so it wasn't that deep for me. And so I treated it kind of shallow. Okay. Right. Yeah. But I realized like today, mm-hmm. career-wise, position-wise, uh-huh. I'm in a beautiful position to be able to work with you. Yeah. As the president of Remar Review, and to be a part of the Remar Nurse family, which the path wouldn't have otherwise worked out that way. Mm-hmm. That's true. Yeah, different purpose. I like that. According to the purpose. So you remember that nursing school? Yes. That we contacted about 3.5, almost 4 years ago. Spoke with the president. You know what? Yeah. They called. Mm-hmm. They called. They did. And you got to go. I did. And you got to teach. I did. And what I realized is that even though it didn't work out at that time, God was still working things out in his time. That's true. And so at that time, I wasn't ready for that relationship in terms of marriage, mm-hmm. but I was ready for this relationship. Mm-hmm. I wasn't ready for that career, but I was ready for this moment, this career. At that time, the nursing school wasn't ready for you.
Right.
But now they're ready.
Right.
At that time, the VT wasn't ready for the student.
Right.
But what it did do was allow us to get it ready for you.
Perfect.
And so everything that seemed like a failure, that seemed like a disappointment, that seemed like why God is this happening, has worked together for this very moment in time. And I'm so glad.
Yeah.
I'm so glad fell out of law school. So glad. I'm so glad that relationship ended with integrity.
Right. I got you.
With no hard feelings broken. I'm so glad that it ended.
Right.
I'm so glad that we didn't get the call back at the time with the nursing school.
Yes.
Because what it did was allow us to pray for those students and that school for the last 3 years.
Right.
And now that group of students that we were praying for, they're now in their senior year.
They're graduating.
And you get to teach them.
Oh, yes.
I'm so glad.
Yeah.
I'm so glad that the student broke into the VT early.
True.
To allow us to get stuff together for you today. And I'm so glad that you are here with us right now, even as a repeat tester, even dealing with the anxiety, whatever you've gone through, just understand that God has been there with you along the way. And so we know that all things work together for the good of them that love God and are called according to his purpose. So if you're worried about how things are working in your life or if they're working together or not, make loving God that number one thing, and he's going to work everything else out in the background if you're called according to his purpose. So you had a time, you had a season, you had something that you said, okay, I'm going to do this by this date. By this time next year, I'm going to do X, Y, and Z. And God's like, okay, all right, just keep loving me in the process and let's see how this goes. Because he has so much for you that you may not even know. I had no idea I would meet this wonderful, beautiful, intelligent gift of a woman who happens to be the number one Nclex instructor on the planet.
Nice.
But I'm so grateful to be a part of your life and your life. And just want to encourage you that it's going to work out. Keep loving, keep God first, and just believe.
Yes. I think that's so relevant because I think some people can look at their life and be like, wow, why am I going through this trial? Or why didn't this happen for me in the way that I thought it should happen for me? And then when they cross that, when they cross that river, cross that mountain, cross that bridge, they'll be able to look back and say, no, now is the time that I'm prepared for the success.
Yes.
Like, I think that's what it is sometimes, is that God wants to bless us. He wants to abundantly bless us. But sometimes we need to go through some things so we know who to acknowledge. Because if it had worked out the way we planned it, the way we, mapped it out, we would try to give ourselves the credit for it.
All day.
But when we have experienced, when you have experienced a failure and literally God had to drag you through a situation, then you know that I have not done this on my own. It is God who gets the glory. So I see that. That's such a relevant message for me, and I'm sure for the Remar nurses. We do want to say thank you. And I know, you praise me and I'm happy. I'm very happy to be your wife, 100%. But it's something about a man that knows God's word and that can draw your attention to, the Lord. There is something rare and something unique about it. And so what you contribute to the Remar family is essential. And it's what makes this review different, I believe. I don't know if other people are willing to profess their faith the way that you are, the way that I do. But I know that the Remar nurse community resonates with that, and they have made it a part of our culture. But remember when we were scared, I know I was just like, are we really going to do this? Like, are we really going to, present our Christian faith and our values, to this scope of strangers? But actually,
family.
Yeah, actually, you guys, you turned into our family.
That's right.
And so we can come here and we know that
we don't have to be ashamed of what we believe in.
Absolutely. So every single week we have our staff meetings, and we're praying for you all every day, included in our prayers as well as a family. And we're going to ask you to do the same for one another. Pray for one another, encourage one another, strengthen one another. Anytime you have a goal in mind, it can be challenging to keep your focus on God, to keep your focus on the positive things, even if you're especially if you've ever dealt with failure, if you've ever dealt with disappointment and anxiety, it's hard to stay focused on God. So we want to encourage you as you're getting this information, as you're getting this knowledge, as you're getting this understanding, to understand where the source of our help and our strength comes from. And so we want to share the best of what we have with you. We want to take what's in our mind and our hearts and be able to share that with you so that you can grow in the process and so that you can have an amazing experience. And so we just thank you for being a part of the family and want to join you again on the next time that we're on live.
Okay. Thank you guys so much for joining me today, studying for your Nclex. It was a pleasure. Literally, I'm honored that you guys would come and circle around and study with me. And I hope that you guys know how much we love you and how much we are really invested into your success. We want you to be successful so that you can give back to this family as well. Because that's what we do.
That's it. That's it.
Have a great weekend. It's the holiday weekend.
Before we go.
There you go. Before we go.
All right. Listen, guys.
I almost forgot. No.
What we got?
What do we have to do before
we gotta pray.
You gotta? Yeah.
We gotta pray.
You would not believe the emails I would get if you didn't pray.
But that's the thing. It's like we're praying all the time, also. But so we will definitely.
Let's do a formal prayer for people who are just now started studying. People who are testing.
Listen, I forgot. There's one last thing. Okay. One last thing. Like, we're in the Sabbath time, so we transition.
Okay, yeah.
But seriously. I have to give this because it's still from God, right? So at the beginning of the year, 2019, if you go back to the videos at the beginning of the year on YouTube, Facebook, etc., we made a promise.
Did we?
Yeah, we made a promise.
Okay.
And God reminded me like 2 weeks ago.
Okay.
Right? Do you remember what the promise was? All right, here's the promise, guys. So so we promised. We said that every week we would do what? Every single week,
giveaway.
We would select somebody.
Oh yes, to pay for their Nclex.
And pay for their Nclex.
Yes, that's so true.
Yeah, and God hit me like we got busy. I think Remar Nurse University came about.
Oh, that was crazy.
And we were traveling, and like it kind of just honestly just fell off. Like it fell to the side. But it was like a for real promise, right? And so we want to make sure that we are honoring our commitments to you all and honoring our commitments to God. So on Monday, we're gonna have a list of names of individuals. Some that got the previous program, some that got the new VT.
Oh wow.
So today, yesterday, etc.
Wow.
And we're gonna announce that list. I believe it should be at least like 20 folks. And we're paying for your Nclex. All right. So we're gonna have that list on Monday.
It's gonna be great.
All right.
I can't wait to see it.
God reminded me, like, wait a minute, you can't just say stuff and not do it. Like, you have to keep your word. And I know nobody was like emailing and say, hey guys, you said this or that. But God reminded me, so I want to make sure that we keep that promise as well.
I like that.
All right.
Yeah.
So we're gonna keep our word.
We're gonna pray for people that are new to the Remar family. And we're going to pray for people that are testing. There's some people testing tomorrow and next week and the next 2 weeks from what I saw. We pray for people that are sick and trying to study as well. Okay.
Absolutely.
Okay.
All right. Listen, guys, let us go ahead and pray.
Okay.
Is that all right?
Mm-hmm.
All right, cool.
All right.
All right. Thank you, Lord, for an opportunity to simply come before your people and to be of a help, be of a service, and be of a benefit. Nursing, Lord, is a calling. It's a desire. It's a passion, Lord, that I believe you put into individuals, and you give them the gift of help. You give them the gift of knowledge and wisdom so that they can be good stewards in caring for individuals who are in the worst part of their lives, who are experiencing trauma, who have experienced physical difficulties, and who are just in need of a helping and a healing hand. Lord, I ask that you would bless each and every nurse under the sound of my voice, Lord, so that you would allow them to be successful in answering the calling that you have given them in the way that you see fit. Help them to be diligent in their studies. And Lord, as they study, I ask that you would watch over their households, watch over their family members. I know a lot of them are caretakers. They're taking care of their own family, and there might be sickness for their husband or their mother, and just the common things of life, Lord. But as they're doing this, as they're watching over their children, Lord, I ask that you would guide them in their studies and give them an extra measure of provision as they are looking to obtain their nursing license, so that it's a smooth transition. And Lord, if that provision is not there, I ask that you would simply give them faith and patience, and to know that you are watching over them and their family and their household in the process. Now, Lord, I ask that you would take their anxiety, Lord, and take it down, Lord. I ask that you would remove their anxiety, give them a peace that goes beyond and surpasses all understanding, so that they have a calm about this process, not a calm that would cause them to be lax, but a calm and a patience that if they would do the work, that you would honor that commitment, Lord, with good results. Be with us as a company, Lord. Be with our staff as they continue to grow and to develop and to help the Remar nurse community. This is our prayer, Lord, that you would simply watch over this process. And we want to commit ourselves to you as even more so than we're committing to this process of getting that license. There's two letters, Lord. There's a PN, there's a RN, and everybody wants to get those. But we also want to hear those two words at the end of the day. Well done. So this is our prayer. In Jesus' name we pray. Amen.
Amen. I like that. Yes. Well done.
Well done.
Well done. Well done. Well done. All right, guys. Thank you so much. Thank you so much. Thank you guys for joining me. It was a pleasure again. And until Monday. Until Monday. So we will say thank you, Facebook, for spending some time with us. We will see you on Monday. You can, you will, you must.
Pass Nclex.
Pass Nclex. Absolutely. You can, you will, you must pass Nclex. I love that saying because it just cuts out all excuses. It really does. And then YouTube as well. Thank you guys so much for joining us. Everything was awesome. The comments, the community, the family. So we hope that you have a very restful weekend and happy holidays to you all. Enjoy the blessings that you have. All right. Bye.
God bless, guys.